Hello, my name is Shayla Perez, and I will be presenting my term project at this time. I'm going to share my screen. Okay, so I got Acepromazine. The drug name informs Acepromazine. It is available in 10 milligrams per milliliter in the injectable form. It's available also in 5 milligram, 10 milligram, and 25 milligram tablets, and it's only approved for use in animals. There are other names or brands for this drug. We have Prom-Ace by Fort Dodge, ACP, Atrovet, and ACE Project or VetUs. And what I found is that Fort Dodge is actually a subsidiary of the famous brand Pfizer. I know we all got our COVID shots. Yeah, they are a subsidiary of Pfizer Inc. The class of drug, it is classified chemically as a phenothiazine neuroleptic. It's available by prescription only in most US states. It is available in California over the counter. It is related to chlorpromazine and prochlorpromazine. And a phenothiazine neuroleptic is basically a drug that modifies the chemicals in the brain to affect or change behavior in animals. The type of medical condition this drug treats or prevents. Well, technically, it doesn't really treat anything. It is mainly used as a pre-surgical tranquilizer or pre-anesthetic. It is effective in alleviating vomit caused by motion sickness, and it is also used as a sedative to help dogs cope with fear and anxiety. How is this drug dispensed or the route of administration? It can be dispensed in basically all of the ways. So subcutaneous injection, intravenous injection, intramuscular injection, and by mouth or PO. How does this drug work in the system? So it works by depressing the central nervous system. The actual mechanism is not known, but its effects are attributed to its potent antagonism of postsynaptic receptors. So basically, it interrupts the dopamine in the brains, which is used as a communication device. That's the brain's communication device. The effects last 6 to 8 hours, and it is metabolized by the liver, which is oxidized to produce its primary metabolite, hydroxyethylpromazine sulfoxide, and then it is excreted in the urine. The therapeutic range for this drug. So this goes for any drug, really. They should not be administered without first consulting your veterinarian, but the usual oral dose is 0.5 to 1.5 mg per pound or 1 to 3 mg per kg. The injectable dose is 0.01 to 0.1 mg per pound. So it's very much less than the oral dose. The efficacy should be tested if it's used for a stressful event. So if you're going to use it for fireworks or for a car ride, you should first do like a test to see how effective the dose is. And if the dose is not effective, then it should be slightly increased, emphasis on slightly. But it ultimately depends on the pet. You know, every pet is different and owners know their pet best. With the help of the veterinarian, they can figure out what is the therapeutic range for the pet. Is this a toxic drug? Why or why not? It can be toxic. Seizure patients, they have been found to actually increase or cause seizures in seizure patients. If they're combined with other drugs such as narcotics, barbiturates, epinephrine, antacids, and antidiarrheals, they can have adverse effects. And of course, if the pet has an allergic reaction, it should be avoided. It should not be administered at all. Case study of the animal patient the drug would treat. So this is a study by Dr. Barvalia, J.J. Ranparia, N.R. Padilla, and C.B. Javia. The objective of the study was to evaluate the anesthetic efficacy and safety of a combination, which is butorphanol, acepromazine, and glycopyrrolate, as a premedicament to midazolam slash ketamine induction and maintenance of anesthesia with isoflurane. The dogs were pre-medicated with intramuscular injections of the cocktail, and the pre-anesthetic combination provided moderate to profound sedation. Induction was smooth and satisfactory in all of the dogs. So yeah, this has been studied. This has been looked at to make sure any adverse effects are avoided. So basically, to sum it all up, acepromazine is classified as a phenothiazic drug, meaning it depresses the central nervous system. It's mainly used as a pre-anesthetic, but it can be used for stressful events. It should be used with caution in patients with seizures, hypotension, since it does dilate the blood vessels to lower blood pressure and cause that sedative effect. Certain breeds like boxers, collies, border collies, Australian shepherds, it should be used with caution basically because they have a mutated gene that causes those adverse effects. And if there is a known allergy to acepromazine, it should be avoided at all costs with all patients that have said allergy. And again, this can be administered subcutaneously, intramuscularly, intravenously, or by mouth or orally. And these are my sources. Thank you so much for watching my presentation, and you have a great day.